Neurodegenerative diseases are a group of disorders characterized by progressive degeneration of the structure and function of the central nervous system or peripheral nervous system. The risk of being affected by a neurodegenerative disease increases dramatically with age. More people living longer means more people could be affected by neurodegenerative disorders in the coming years. Advances in research have allowed us to better understand neurodegenerative disorders, but one of the biggest challenges in today's healthcare system is the development of new therapeutic strategies, new drugs, and new diagnostic tools. We all need new approaches for treatment and prevention. This type of disease causes memory and cognitive impairments and often affects people's ability to move, speak, and breathe. Handwriting involves cognitive planning, coordination, and execution skills, which is why handwriting is one of the abilities affected by neurodegeneration. By observing the handwriting performance of people with neurodegenerative disorders, specialists recognized significant changes and important differences. The research community is focusing on the idea of using the performance of handwriting to build systems that can assist the diagnostic process. These systems and tools use artificial intelligence techniques, and they are becoming more and more accurate and reliable. A patient can perform simple writing or drawing tasks on a graphics tablet. In the wild, an acquisition software records space-time coordinates, position, movement, velocity, acceleration, and pressure. In this way, data were collected from 175 subjects, divided among healthy people and Alzheimer's patients, who performed 25 different writing or drawing tasks. Tasks are divided into classes: graphic, copy, memory, and dictation tasks. Sometimes, the performance of patients is very far from that of a healthy subject. In this view, our work proposes a multi-classifier approach that evaluates handwriting tasks to help the diagnosis of Alzheimer's disease. We propose various multi-classifier implementations. The objective of the research is to investigate the possibility of achieving good performance by exploiting as many classifiers as there are handwriting tasks selected. Attention has been paid to whether it is possible to improve classification score, reducing the number of tasks selected and the time required for the entire diagnostic test. The single classifier approach is that of merging the features extracted from each task into a unique representation. That representation is used by the machine learning tool to build the classifier. On the other hand, the multi-classifier approach uses several classifiers, each one processing features obtained from the execution of a single handwriting task. All the outputs are then combined by hard voting to reach a single classification output. This approach does not limit the use of a single classification tool. It is possible to use a different classifier for each handwriting task, using the one that best suits the specific task. With this approach, the best performance of the multi-classifier is the same as the single classifier approach. At this point, a question caught our attention. Are all the tasks essential to obtain a good level of classification? Using the multi-classifier approach, it is possible to select the set of tasks and classifiers that allows for achieving the best classification score. For all the classification algorithms considered, is search the sets of tasks that allow reaching the best performance. By limiting to subsets of tasks, performance improves concerning the use of all 25 tasks, reaching a maximum accuracy of 91%. In this case, the multi-classifier approach registers important improvements over the single classifier approach. By reducing the number of tasks to consider, the time to complete the entire diagnostic test is also reduced. The time required to perform all 25 handwriting tasks is around 21 minutes. The time required can decrease significantly, and accuracy can increase. Handwriting activity can be an innovative way of characterizing the peculiarities of neurodegenerative diseases. By training machine learning models, we can help physicians in early diagnosing and in monitoring the effectiveness of treatments.